Is mental health important for people living with lupus? Many studies suggest that this is the case. Surveys show that symptoms such as anxiety and depression are quite common among people living with lupus, and they're often among patients' biggest concerns, sometimes even more than disease activity itself. But mental health is more complex than just anxiety and depression. There are many different psychiatric conditions, and we still do not know which of them are more common in people living with lupus. Even more importantly, we do not fully understand how these conditions may influence the course of lupus over time. In our study, we wanted to explore these questions, and we looked at all people who have been diagnosed with lupus in Sweden between 2005 and 2021, and we included over 4,000 individuals. And to understand also how common these conditions are in the general population, we compared them with 10 people without lupus for each patient. First, we looked at the period before lupus was diagnosed, which we know can take several years. We found that about 20 out of 100 people with lupus had received a psychiatric diagnosis in the 5 years prior to their lupus diagnosis. And the most common diagnoses were anxiety, depression, and substance use. Importantly, these diagnoses were more common in people with lupus than in the general population. Next, we looked at what happened after the lupus diagnosis. And we found that about 10 out of 100 patients received a psychiatric diagnosis within the first 5 years, and about 17 out of 100 within 10 years. And the most common were again anxiety, depression, and substance use disorder. Finally, we asked whether having a psychiatric diagnosis was linked to how lupus develops over time. We found that people who had a psychiatric diagnosis were more likely to develop organ damage and had a higher risk of death over time. However, it is very important to emphasize that this does not mean that psychiatric conditions cause organ damage. Rather, it suggests that people who experience these conditions may be more vulnerable and may need additional support. The key message is that mental health matters in lupus. We hope that mental health can be discussed and screened for during medical visits, and that support can be offered when needed.